thank you so much for inviting me to come. It's really exciting to be a part of something that's launching in Missoula, and I love that there are a lot of people in here that I can ask questions to, because that's, I think, part of the being an entrepreneur that is the loneliest, is that you don't have a lot of people to bounce ideas off, and I can become sort of isolated in my own thoughts. I can stay up till 2 in the morning. I wish there was more time, so I really understand being up until 1 in the morning, trying to work things out with somebody, so thank you guys so much. So I wanted to talk about Hestia In-Home Support, and that's the company that I just started, and to give you a little bit of history of why would I do something so crazy like that. So I started off in college. I've always wanted to be in healthcare, and I was pre-med when I was in college. And I wanted to be a physician. That was my big, hairy, audacious goal at 17. And I couldn't imagine why everyone else didn't want the same thing. I thought, well, maybe you thought that'd be too hard, or you'd be to school too long. But it was something I was so passionate about. It was really my goal. And then I ended up working for a rheumatologist as a medical assistant, where I met Sid, which is amazing that you're here now. And when I was there, I had the opportunity to help with the WAMI program. So the WAMI program got internal medicine students in Missoula through the program, and they got to be with different physicians. And when I was doing that, I asked a lot of the physicians, do you like your job? Like, what about that? What is the plus? What's the minus? How is that going for you? And overwhelmingly, the answer was that they did not like their job. They weren't really happy with the way HMOs were changing healthcare and how they were designing what physicians would do. So what would they prescribe? How did that look? And I knew in a heartbeat that that would really be a hard thing for me, because I don't like to be told what to do. And I would want to do it in my own way, so I'd get kicked out of every hospital in the world. So I thought, okay, I won't do that. But what else would I do? So then I thought pharmaceutical sales sounded really sexy and fun. Medical sales sounded really awesome. So I looked into those things. And at the same time, my mom had run a hospice in Utah. So she wanted to start a hospice in Missoula. And I thought, well, that sounds like it would be a really interesting thing. And I really had a lot of experience knowing her and what that hospice looked like. So we started Hospice in Missoula in 2002. I left the practice that I was doing with Peggy Schlesinger, who was the MD that I was working with, to start Hospice in Missoula. And it totally changed my life. It changed the way that I thought about healthcare, and it changed the way I thought about my career. Because I could see that navigating a whole team that would bring healthcare into the home for people who needed it was definitely my cup of tea. And even more so, having a whole team that worked together. And I didn't see that in medicine. I didn't see that at all. What I did see was a physician would call their physicians on the phone when they had a question, and that patients would then have that experience, but they didn't get a whole interdisciplinary team. So it wasn't a spiritual piece, there wasn't an emotional piece, there wasn't a psychosocial piece. You know, it was just that clinical medicine piece. And Peggy's an amazing physician, and she really does address all of those. That's why her visits are all 45 minutes or longer, if anyone knows. So that was part of what I took away. So I did Hospice in Missoula for some years and loved it. And then I did sort of get pulled to Seattle from a guy. And when I was there, as we all know, life happens. And when I was there, I did do pharmaceutical sales, which was really interesting because for me, I thought, great, I'll do pain management. So I worked for Endo Pharmaceuticals. And they do Lidoderm and Percocet, and I thought that would just be so rewarding. And it really wasn't. I was so disappointed because I was just a salesperson, and I didn't get to see how that affected patients in their lives and what difference that made. I just got to sell drugs. I sold drugs. Applause. So that was a pretty interesting experience for me. And while it was really rewarding in some ways financially, it wasn't as rewarding and making a difference in people's lives that I was looking for. So I ended up leaving that, and I went to work for Aegis, which is an assisted living and then memory care and independent living group in Seattle, and they're all up and down the West Coast. And they were fantastic in the way that they thought about their care. They wanted it to be like a home. And they were growing so quickly that I got to help them balance what was it like to have a headquarters and grow nationally and keep that continuity. So it was such a great experience for me. Then, how much time do I have? I can't see. 9 minutes? No. That's what it looked like. Okay, perfect. So anyway, at that point, I ended up moving back to Missoula because all my vacations were back to Montana. As you all know, you move away thinking you don't want to be here, and then when you move away, you realize you want to be here. So I came back to Missoula, and I did some work with a hospital, and I worked for the Hospice Care Foundation. And at that point, I needed to step back into the family business and help. So for the last 3 years, I had the opportunity to run Hospice in Missoula, which was really nice for me because it got me back to something that I really loved. And I could see the difference that I was making in people's lives every day. And it wasn't me, it was my team that would go into the home and provide that holistic care that people needed. And then I got to sit in meetings and IDTs, which is an interdisciplinary team meeting, and hear about the difference that that was making. And it was, I mean, that's one of my favorite things. So it was really rewarding. But the part that was hard was that we had a lot of people come to us and say, okay, I need that hospice type care, and I don't know if I'll qualify. So we would go out and meet with them and see if they qualified for hospice. And if they did not, there wasn't something else to steer them towards. I couldn't find something else that fit that medical model that had spiritual care, emotional care, and the whole team support. And it was a really frustrating thing because I knew that they needed that, but they just didn't qualify for the hospice benefit through Medicare. And so at that time, I went to a national conference that was in Texas, and that was run by CAPC, which is the Center for Advancement in Palliative Care, to see, I can't be the only one seeing this. It's not only in Missoula, Montana, and it wasn't. This is a national trend. There's sort of this gap in healthcare where there isn't someone that can attend to people and their needs. And when I went there, I thought I would have the answer because there were 500,000 people there, so 500,000 people. And everyone was there with the same sort of, we don't know either. I was like, crap. So everyone is really chasing Medicare to sustain a program, and there just isn't a way to do that. Medicare doesn't, it's not that they don't care, I'm sure they do care, but they don't address that. Medicare is for physician visits, they're for hospital visits, and then they adopted hospice later. But between all of that, that big gap in care, they don't pay for anything inside of that. So if you're at home and you need a team to support you, Medicare is like, okay, great, but they don't provide for that. So I left and thought about Hestia and what a benefit that would be, and that's how Hestia was developed. So it's very much an echo of hospice. It's very much the same as an interdisciplinary team that goes into the home, that we provide care. We have a physician-based practice, so our physician will go into the home and do house calls, which is amazing. But because we are private pay and we are independent, we have the opportunity of making that care plan for someone whatever they would like. And that's really exciting to me because my care plan would be so much different than any of yours. I want chocolate every day, for sure. And I want someone to bring a furry pet because pet therapy would be great, but I don't want it to be my pet. I want to feed it. Like, I don't want that. I want someone else to bring me something that I can cuddle with and then take it away. I know that no matter what, I'll want to go outside. So even if I can't tell you that, I want you to bundle me up and take me outside if it's raining, if it's snowing, if it's sunshine, because that is meaningful to me. And what we get to do is to know people that well and to develop a care plan for them. So that's, I think, I have 5 seconds. I can dance. We're close.
Thank you, Maurika. And so
Thank
then
you.
the follow-up question to that is, how can 1 Million Cups help Hestia?
Boy, so many ways. I mean, I just wish that I had all of your brains to pick at 2 in the morning because that's what I'm thinking the most. So if I can have all your phone numbers and you don't mind, that would be the best case scenario. But for sure, it is, just bouncing ideas off of other people and having an understanding of what hurdles look like to you. Because very much like Nate said, I started out completely different than Hestia is now. I thought for the certain price range for everyone, it'll always be that, and I can provide the whole team and it'll be beautiful. And then I went out into the community and they were like, oh, not quite that. I want it to be a little more of this. And as a startup, you do have the ability and the flexibility to pivot and sort of meet the community's needs. And they will tell you what they need more. And that's been such a great thing. But I would love that input from everyone here. So just having that network of advisors is really, really hugely beneficial to me. So thanks for that.
Any questions that...
So
Go.
No one wants to talk about aging, but it's really fun, you guys. Okay, good.
I'm training for middle age. We need to talk about
Right.
Training.
Me too.
I think I had
2007? Yes. Okay.
Your newspaper, would the headline for this read, former drug dealer finds job fulfillment bringing holistic health care?
Totally.
Yes. I would be honored. I'm not even kidding. I like that.
Great. Can you explain to me a little bit more, like you have a team of providers and physicians, so you're really building a customized healthcare plan for somebody and bringing it to them, right? How deep do you go? Or how deep can you go with the customization? And I mean, furry pet walks in the park.
We do all of those things, right? Yeah. I mean, I think that that's a really excellent question because people have found their own limitations, but they're not something that we ever have built for somebody. So that's where I sort of feel a little bit reluctant to put a list of here are all the services we provide, because then people will say, ooh, I wanted something that's not on there. So, and that's not the way that it is. We could do anything that someone needed in the home, and we have such a wide range of providers that can do all of those things that I just give people ideas and then ask them really more questions about them. And when you're in someone's home, I mean, you really do learn so much about what they care about, what brings meaning to their life, what did they used to do that they're not doing now, and how can you help bring them back into life when they didn't really know the possibility of it. And that's the magic to Hestia that is hard to really talk about because you can't put it on a list. It isn't something like that, so you can go as deep as someone wants to. The coolest thing is that it's the stories about those successes of bringing independence and freedom into people's lives that are so rewarding to me. And we took a couple on a date that they haven't been on a date for 5 years because they live in an assisted living and she can't get out of the facility. And there has never been a CNA that could chaperone them to something like a movie. Super simple. And they live really close to the movie theater. So we just put a bar on their car that would help for transfers. We practiced multiple times, and he wanted to drive, which was great. And so then we got them to the movie with our caregiver in tow, so they all went together. And as they left, she looked at the caregiver and her husband and just said, "Where to next? Like with you guys, we could do anything." And I thought, that gives me goosebumps when you think that this woman couldn't leave her home. So we really do have that possibility, which is so much fun.
Now that you have this going, have you reconnected with some of the associates you met at this national conference that saw the same hole that you did? Are other people like you independently starting, not Hestia, but Hestia.
Hestia babies
their
everywhere?
own Hestia? Are you finding people to connect with, or are you thinking, I'm gonna nail this here and then I'm gonna expand? Like that assisted living community that you worked with in Seattle that was now expanding. Kind of where do you see it going?
My goal now is to expand Hestia's, and we are looking at different models of that. Do you franchise it? But then there's the medical, every state has their own medical regulations, and how would you do that? Now there are all these lawsuits with franchises. If you get too invested in making sure their quality is how you want it to be, then the liability is on the owner and the person who's franchising the business. So that can be a little tenuous, but there are some organizations like Consumer Direct. So Bill Woody is a local owner of that, and he's done it in a different way, which I like too. But I did get in touch with CAPC, and I've talked to them as I've developed Hestia to see who else is doing this and what does that look like nationally. And really we would be palliative care. That's what that organization would see us as. But because we've made that so synonymous with hospice, I'm really reluctant to tell people that because they're like, oh, hospice, that's not what I'm looking for. But palliative care is just meant to bridge that gap in, you have an illness, you're getting older, you don't have that support at home. Then there's this huge gap where you're in the ICU and in the ER. You can't really manage your care, and then there would be hospice. So in that gap, that's where nationally they're calling it palliative care. So lesson for all of us, that's not hospice. So what I would like to do is make sure that I'm connected to them. They're really focusing their efforts on doing hospital-based palliative care. So having an interdisciplinary team in a hospital that would address those needs in the ICU and in the ER. And they aren't looking as much at, although they're starting with the community-based. But the answer is that everyone looks different. Everyone is designing their program differently, and nobody is doing an interdisciplinary team like Hestia. So it'll be nice. I can be the prototype and help them with that. So yes, it's nice to have that connection for sure. Chad?
Maybe I should know this, but why the name?
So the name, I knew from inception that this was something that, because I'd been to the palliative care conference and there weren't any other programs like it, I wanted to be able to grow it nationally. And so I looked at trademarking elder care and care at home and all of those names that really popped into my mind right away, and they're already taken. So I just nerdily got onto the computer and Googled Latin names. Well, what about Greek names? And Hestia came up, and I was like, oh, I like the sound of that. And then it also means she's the Greek god of or goddess of hearth and home. So it had some meaning too. And I was like, jackpot. So it was just luck. It really was sort of luck, but it does have some meaning too, which was fun, yeah. Russ?
Do you limit it to, say, people who are facing, aging, or do you open it up to, say, people with things like traumatic brain injury, things like that, which is a big challenge?
Yeah, that's a really good question. We can see the possibility that we could serve anyone. I think I need Hestia very often as a single mom with 4 kids, right? Please, dear God, someone do my laundry. So I think we could help anyone who needed it, but we're really focusing our niche on the aging population, but we wouldn't say no to somebody who needed our help. So we have, helped a woman who was pregnant. She had a really difficult pregnancy with twins. Her husband was out of the country, and she was really isolated and alone and had a hard time getting to appointments. So she needed someone to come into her home and help care for her. And it was her physician that understood that we could also do that. So we wouldn't limit ourselves, but so that people have a better understanding of what we do focus on the aging population for sure. And I think we want to bring aging back. Like, could that be sexy? I don't know. I think so. We just don't talk about it as a culture, but we're all going to do it. I'm not going to rock anyone's world by saying that. So, come
The
on.
older we get, the sexier.
I know, I think so. That's right. We'll adopt accents and we'll be dead sexy.
How do your prospects currently hear about Hestia?
That isn't as I thought it would be. So originally, I thought that most of our prospects would come from the medical field because that's where all of my referrals came from in hospice. And I think that that's a really interesting dynamic in social psychology, which is incredibly interesting to me, that if you are going to give a medical system that's very used to having these ways that they do things, a different way of doing it, they're really suspicious about it and they don't really know how to fit that in their process. So most of my referrals come from word of mouth and then advertising that we've done over the radio and just as connecting with people in the community that can identify somebody who needs that help. And that's, I would say, 95% of our referrals. We have gotten some now from like a skilled nursing home. So if someone went into rehab and then they knew that they weren't going to be able to be at home safely and they were looking at assisted living. But this happens all the time. I don't know if you guys ever had to help someone through that process. They don't want to leave. They don't want to move their home into an assisted living because you're talking about taking this much into that much and then giving up the independence of living in your own home. So now that they understand that, we have started to get some referrals from them, which I think is great. Any other questions? I have lots of handouts I want to give you.
So I have another question, and I think this is probably on a lot of people's minds as it relates to any sort of healthcare. How is it paid for, right? Like if it's not a Medicare thing, and is insurance cover it, or like do we all need to create our Hestia account right now?
Yes, this is a really good question. So this is one of the other things that will really keep me up at night worrying is that we're aging. Our population is aging and we are living longer than we've ever lived before. There are fewer gerontologists who care for the aging population than there have ever been before. And we're planning worse than we've ever done before. So less 401ks, less long-term care insurance. But this is something that you will pay for privately. And so it is a private pay thing. Long-term care insurance will pay for Hestia. So if you've planned in that way, then it would be paid for. And so I think it's really important for us to start thinking about it before we won't qualify for getting a long-term care insurance plan because you can't get that when you need it the most. You need to plan ahead to have that for yourself. So it is, I get the question a lot about having a physician that comes into the home and people think that that's pricing us out of the competition, but we're less expensive than an assisted living and we can do what they can do and more. We're less expensive than a skilled nursing facility for sure, and we can do that level of care at home. So most people go into a skilled nursing facility because they need around-the-clock nursing care, or they at least need that skilled care of a physician seeing them sometimes. And we can do all of those things in someone's home for less money because we don't have the building and, we don't have that overhead. So it is a nice option and it is more affordable, but I forget to say that because that's not the coolest part, but it is true.
But in a sense it is. I mean, so it sounds like, I feel like when I was first learning about what you were doing, you have this short tail client prospect right now where like you want someone to refer their parents or themselves, but there's also this long tail thought where like I'm about to turn 40 and maybe the biggest gift I could give myself is this long-term care insurance
Mm-hmm.
because when I'm 65 or 75 or 85 I won't pass that burden on to my kids, and ideally you're still there, and now in 20 years it isn't this weird gap that doesn't fit into the system.
Right.
So it is part of the conversation.
It is true. I mean, I think that there is that piece of that's when I say bringing aging back and making that a sexy thing to talk about. It's just a fact, and let's just bring it up and talk about how will we plan for that phase in our life. I mean, when you're pregnant, you just don't think, well, when I'm like 9 months pregnant, I'll go see somebody. Like, from the moment that you are considering it, you're talking to your physician, you're talking to friends, you want to know what that will look like, and you plan for it to be the way that you'd like it to be. Just like every plan, it doesn't always go as you like, like none of my pregnancies went the way I wanted. But I had a plan and I had information and I tried to get that as close to what I wanted as possible. And I think aging and death and dying are the same thing. And we just don't do that well. It's sort of a forbidden topic.
Well, and I'm going to put my insurance hat on here with a room of entrepreneurs and business startups. That is one thing in which, as a business owner, you can write through your business and it's tax deductible. So it's something to do. I mean, to your point, the younger you do it, because it is one of the hardest things to get underwritten for. So to have that tax advantage, I think a room of people that own businesses should know that for sure.
Yeah, I've worked with Jen pretty closely in helping educate people about long-term care insurance, and she taught me about how to do that through my business and what that will look like. So, I mean, it is sort of bouncing those ideas off of other people and seeing what you can learn and how together, you can help to make a difference, because that, they call it the silver tsunami, this aging. Like, it's coming and it is going to never stop. So the statistics are, in 2050, there will be as many people over 65 as are under 5. And it's not because people are stopping having babies. There are still going to be as many babies coming. But our population is just living till 80 is the average age nationally. And it used to be, 65 when Medicare was developed. So they didn't really think about how will we care for that age group. I mean, they don't pivot as quickly. Medicare's not like, okay, got it. It'll take some time. Any other questions? Thank you guys so much for being here.